Hi there, and thanks for joining us on Chicago Tonight, Black Voices. I'm Brandis Friedman. On the show tonight, complaints of unsanitary and unsafe conditions at a migrant shelter in Pilsen. New emails shed light on what the mayor's office knew. One-on-one with the new leader of the city's public health department. Efforts to support Chicago's unhoused as frigid temperatures stick around.
14 pairs, number one is just a vibe.
And bringing paradise to everyday life ahead of Chicago Restaurant Week. And now to some of today's top stories. The mayor's office has responded to WTTW News, reporting that emails sent in late October to Mayor Brandon Johnson and other top staffers warned of alleged unsanitary conditions at a crowded Pilsen migrant shelter where a 5-year-old migrant boy eventually fell ill and died. The city has also reversed course today and unredacted the corresponding emails after it had nearly completely redacted emails in response to a Freedom of Information Act request. The unredacted emails confirmed WTTW's reporting that the email warned Johnson and others about allegations of insufficient bathrooms, exposed pipes with raw sewage, cockroach infestation, a possible outbreak of illness, with many people being sick, among other concerns. In a statement, a spokesperson for the Johnson administration says, quote, "The city was aware of issues raised regarding conditions at the shelter at 2241 South Halsted and had actively been in the process of addressing the situation. While the city recognizes that there is still more work to be done to improve the quality of temporary housing for the nearly 15,000 new arrivals in 28 active shelters, we have also taken concrete action to address any and all concerns related to conditions at city-run shelters as they have arisen." Today, Governor J.B. Pritzker was asked about the story.
I did see the report. I haven't heard their response to it. I think we all understand, and the mayor and his administration understand, that we are trying to keep, in very difficult circumstances, trying to keep people safe in shelters as we're moving them on to more permanent housing and jobs.
And you can read that WTTW News exclusive report on our website. The Chicago Teachers Union says Chicago Public Schools doesn't have all the resources it needs to educate migrant students. CTA and the American Federation of Teachers held a roundtable today at Cameron Elementary, where many migrant students have enrolled. They say they discussed some potential solutions, like helping more teachers become trained and certified as bilingual educators.
Why don't we make sure we don't force teachers to pay for something that the school system needs? So pay the tuition. The teachers want to go through the program, pay the tuition.
CTU says in addition to needing far more bilingual teachers to meet the needs of new students, Cameron Elementary is attempting to meet the needs of 126 students in temporary living situations, as well as their families. A group of parents and students are calling on the mayor and the Chicago Board of Education to protect school choice. Today's rally at City Hall comes after the board last month announced they were going to move away from school choice as part of their 5-year strategic plan. Under the current policy, Chicago families are assigned a neighborhood school, but can apply to attend others across the city. Parents at today's rally say charter schools are a vital option for families that should be preserved.
Chicago's school choice system empowered me to find a school that aligns with my values and fit all of my children's unique needs. As parents, we know what's best for our children and have a right to make decisions on what school is best for them too. A one-size-fits-all model approach to education does not work for all students. Charter schools provide parents with options.
Critics of school choice say neighborhood schools lose out to better-funded competitors. An Oak Park woman who pleaded guilty to killing her mother and stuffing the body in a suitcase during a trip to Bali will serve 26 years in U.S. prison. 28-year-old Heather Mack has already served 7 years in an Indonesian prison, seen here, before being transferred to the U.S. in 2021. Here, she pleaded guilty to conspiring to kill her mother, Sheila Von Wies Mack, with the help of her then-boyfriend, Tommy Schaefer, to gain access to Mack's $1.5 million trust fund back in 2014. The judge gave Mack credit for the approximately 2 years she spent in custody in Chicago awaiting trial. Ride the Metra, bring a bike. Metra used to only allow bikes on non-rush hour trains. With more riders than ever bringing bikes all aboard starting next month, they will be allowed on all trains with no extra charge. Metra is also implementing a new code of conduct. Anyone who verbally or physically threatens another rider or Metra employee could face a hearing and be suspended from riding Metra trains. Up next, we meet the city's new top doc right after this.
Chicago Tonight, Black Voices, is made possible in part by Fifth Third Bank and by the support of these donors.
At Fifth Third, we believe when diverse voices are heard and empowered, communities are made stronger, lives are made better, and the future holds greater promise for all. That's why we're proud to support Chicago Tonight Black Voices. Together, we can make a difference. Together, we can drive change.
The COVID-19 pandemic put public health officials front and center. Now, the city of Chicago has a new public health commissioner filling this high-profile role. Dr. Simbo Ige is the first black woman to lead the Chicago Department of Public Health on a permanent basis. This after managing a nonprofit in New Jersey and spending much of her career serving as assistant commissioner for the New York City Department of Health and Mental Hygiene. Dr. Ige was tapped by Mayor Brandon Johnson to fill this cabinet position, and she joins us now, having been on the job for a little over a month. Dr. Ige, thank you for joining us. I hope you get time to unpack soon.
Thank you. Thank you for having me. I'm excited to be here.
What attracted you to this job in Chicago?
Woo, the chance to be the first black woman in this seat, I think that was very compelling. I also was very excited about not being a minority. Chicago is a city where, when you look at the numbers, black people are not a minority here. We are minoritized, but we are not a minority. I thought that was an interesting context to work. And I was also excited about working with an administration that is committed to social justice and racial justice and health equity. I thought it was a right place for me to bring my experience and my expertise to bear. And then finally, the vision and the mission of CDPH. Chicago Department of Public Health has been working for a number of years to address the racial gaps in life expectancy. I was very excited about that. I thought I could add value to that work and help accelerate the achievement of that goal.
So some of the issues that you've got in front of you, Mayor Johnson campaigned on his push for the return of the mental health clinics after former mayors closed 14 of them. His budget has called for restoring 2. We know you've been on the job for a month, but where would you say this process is right now as far as restoring those, and what will the process to get them reopened look like?
Yes, that is a commitment. We are firm on that commitment. We are not going to slow down in trying to achieve that goal. So where we are at the moment is working with the community representatives to help identify where this clinic should be located. We have started the process of recruiting for the workforce who's going to manage these clinics. And beyond that, we're looking at the larger landscape of our services. Our communities have had a long history of disinvestment, and we know that mental health goes along with physical health and social health. That's the triangle. So we want to make sure that when we open our clinics, it is providing a complete slate of services that our communities need. So we're doing a thorough assessment. We're carrying the community along, and we're staffing up to make this a reality.
Complete slate of services. What else might be offered beyond mental health support and clinical services?
Very often when people come into a space seeking support for mental health services, when you look closely, they're also seeking support for housing, for food, for employment, for many other services. And these are people who often have other physical ailments that they need help with. So we want this to be a one-stop location where we can provide immunization, we can provide connection to nutrition support, we can help people find and connect to housing, and other services that are offered by the city. So this is a place where people can get connected to resources and opportunities beyond just mental health services.
2024 is the last year that the city can appropriate COVID-19 relief funds, which have to be spent by the year 2026. A number of other city and municipal agencies are experiencing this, but what concerns do you have about that looming fiscal cliff that so many agencies are looking at?
This is one of the complexities of public health. We have emergencies, and with emergencies come a surge of funding. And then when emergencies are declared to have ended, the funding goes away with it. But our public health challenges remain. So we are advocating very strongly for a more flexible kind of funding that can provide us the opportunity to respond to all of the needs, not just one infectious disease at a time. And so that is a challenge for us. The city administration is working really hard to help advocate for a more robust support for the public health infrastructure.
So Cook County's recent preliminary report, shifting a bit to the opioid crisis, that report showed that in 2023, 90% of opioid overdose deaths in the county involved fentanyl, compared to 15% of opioid overdose deaths involving fentanyl in 2015. African Americans, though, accounting for 56% of confirmed opioid overdose deaths, followed by white Americans, who accounted for 27%, and Latinos under 15%. What do we know about why African Americans are making up the overwhelming majority of these deaths?
Yes. When we see the inequities in our health outcomes, and even with opioid, the challenge is always, when you peel the layers, there are always social determinants underneath that. There's social circumstances and conditions in which Black people live that makes it extremely difficult to cope with life, and the quality of life is suboptimal. And so we see that many health conditions disproportionately impact communities of color, and this is no different. What we have been doing is, again, focus and center communities that have been in the margins, center their needs, identify the drivers of this epidemic, and then start putting resources in place to help support. I do want to flag that this substance use disorder is not just a failure of an individual. It's not just a moral or a weak character. It is a disorder. And so we want to ensure that people have services that can help them in their recovery. One, we want to prevent overdose in the immediate, and we are saturating the city with Narcan. There are new vending machines, there are Narcan in every public library, at police stations, every opportunity we have, and wanting to make sure every individual knows how to administer it in the case of an emergency. But beyond that is making medication-assisted recovery available and accessible to all people, such that people can get medication to support them in their recovery and don't have to do this journey or this treatment alone.
Dr. Ige, before we let you go, of course, we've been hearing a lot of concerns for the health and well-being of migrants in the community, certainly following the death of 5-year-old Jean Carlos Martinez Rivero. We just heard a report earlier in the broadcast about some of the issues that have been alleged at some of these shelters. What does health care on the ground look like for migrants when they arrive to Chicago?
Yes, when individuals have gone through months and maybe weeks of trauma trying to get to safety, they come with a lot of health concerns. So the very first step in that process is identifying what urgent health needs they need. So there's a screening process that happens during the landing zone, identifying those who need urgent health care and connecting them to services. And then once they're placed in shelters, there's ongoing support. We start with a comprehensive medical exam so that we can identify other health issues that people have. And then there are on-site services. Once or twice a week, there are providers on-site that are able to respond to any healthcare needs. If it is an emergency, there are ambulance services. You call 911, they get them to care. So those are some of the services that we have put in place. Now, when you have a lot of people in what we call congregate settings, like in a shelter, hundreds of people together in a space, you know that once there is an infectious disease, it spreads quickly. So we also want to make sure there are measures in place to contain the spread of infectious diseases. So those are the support services.
Okay, a lot of work to do. Congrats on your new position. Welcome to Chicago. Dr. Simbo Ige, thanks for joining us.
Thank you for having me.
Up next, finding relief to Chicago's frigid weather. Most of us can avoid Chicago's frigid temperatures just by staying home. But for those experiencing homelessness, the solution is not that simple. Local organizations work directly with those individuals, hoping to provide relief and find long-term solutions. Joining us to discuss them are Mark Ishog, CEO of Threshold, and Reverend Jacqueline Trish Atkins from Interfaith Roundtable on Homelessness and the Bring Chicago Home Coalition. Thank you to you both for joining us. Mark Ishog, let's start with you. Please give us a sense, if you would, of what Threshold and maybe some of your other organizations that you partner with are doing to respond to the extreme temperatures lately.
Yeah, so we were absolutely prepared for this. We knew a week ago or longer that it was going to be 40 below zero wind chill. And so we put a plan in place. We knew that Sunday and Monday we needed 25 people out round the clock to make sure that anybody that was living in a park, in a tent, under a viaduct, where we do our homeless outreach all the time, that we were going to be there. And that's what we did. On Sunday and Monday, we were out there. We were on the CTAs. We were in parks. We were downtown. And we connected people to warming shelters. We got people to go to the Harold Washington Library. We got people to come to Thresholds. We saved lives this weekend. And that was our goal.
I would imagine you also had to do some work to protect your staff, your team, those people who were going out in the very cold and sometimes snowy temperatures as well.
Oh, absolutely. I mean, we care deeply, deeply about our staff, and we have to take care of them so that they can take care of those that we serve. And they were prepared. They were dressed well. They were supervised well. I was texting the director myself, the director of the Homeless Outreach Program, to say, I'm here for you. If you need me to come out on the west side, where not far from where I live, I will be there for you.
How as your teams got out, volunteers, how did you find folks were responding to the cold? How were the people who were unhoused, how were they handling it and responding?
Yeah, so, we generally serve people with serious mental illness, and all of the complications of that illness make it really hard to get people to come in from outside. They're scared, they're paranoid, whatever's going on. But I think our teams did a really good job, and we expanded well beyond those with serious mental illness. During these kinds of crisis periods, we serve everybody. And as I said, we got 8 people into the warming shelters that wouldn't have gone otherwise. We paid for 5 motels for people who wouldn't go to warming shelters but would go to a motel. And what I told the staff right before everybody went out on the street is that you're not worrying about money this weekend. The most important thing is to save lives and get people warm and get them safe.
Figure out how to pay for it later.
We'll pay for it later.
Reverend Atkins, how have faith leaders, how do you all typically respond, or how have you typically been able to support people who are unhoused, who are homeless?
We have been working with Bring Chicago Home for the last 3 years. There have been faith leaders working before that. But what you have just heard is that we need to create an opportunity that we don't have these crises. When the weather gets cold, it's going to do that in the winter. And when the weather gets really hot, it's going to do that in the summer. And so with Bring Chicago Home, which is a measure on the ballot in March, we want everybody to vote yes. We are now creating a system that will provide funding, a funding that is not used for anything but to create housing, to create services, and to provide for assistance and rentals so that we don't have 68,000 plus migrants that are homeless. We don't have 17,000 students who are homeless. We need to work toward a resolution of the problem. And the problem is very interesting. I heard the doctor speaking. The homeless issue is not because of one person. One person didn't, there's the sociological issues that have come together, the inequities that have so often created the homeless situation for a family or for an individual, that those need to be addressed too. But right now we're looking to work to have Bring Chicago in place and have funding that's only for housing.
And of course, the funding that you're referring to with regards to the Bring Chicago Home initiative is the real estate transfer tax, which will be on the ballot, which would change the real estate transfer tax in order to raise revenue to house the homeless. Viewers can read more about it on our website, of course. But Mark, I want to pivot back to you for a second. Have you all noticed increased need? Are more people in need of homeless services?
Oh, the need for housing services in Chicago has never been greater. I agree with my dear friend here. In fact, Thresholds is one of the leaders in the Bring Chicago Home campaign.
Yes.
We're working with social service providers and housing providers and healthcare providers all over the city to make this happen. because if we can make this transfer tax happen, we can provide over $150 million a year for new affordable housing and for the support services for places like Thresholds and our partners. So yeah, the need has never been greater.
Reverend, tell us a little bit more, please, about the Interfaith Roundtable on Homelessness and the organization and the work that you all try to do.
So the Interfaith Roundtable, we have churches, we have institutions, we have Jewish, we have Muslim. All of the institutions are coming together because we believe, there's somebody that said, house the homeless, feed the hungry. And we're working by sharing this information with our congregations and with the communities so that on March 19th, people will vote yes. We've worked hard for the last 5 years. We're grateful that Mayor Johnson came in and supported this. And we're grateful now that we've been able to have it placed on the ballot on March 19th. And all of Chicago, voters have to vote yes. Once they vote yes, we then proceed and have in place a process so we're not confronted with crisis each winter and crisis each summer.
Mark, a lot of people want to know how they can help, right? Especially at a time like this, it's probably on the everyday person's mind more than it might typically be, especially when the weather is nice. What should people know about how they can help?
Yeah, so I mean, I think we have to recognize that people who are unsheltered or unhoused, they're human beings, just like the rest of us that happen to be, luckily, by the grace of God, housed. And so to treat people with kindness and respect and love, acknowledge them when you see them. If you can help them, if you can give them money for food, or if you have a blanket, or if you have something, but try to do whatever you can. Of course, donate to local organizations that are making a difference. Volunteer at your food pantry. Chicago is a place, I think, filled with people that love and care deeply. And I think during these moments, we need that love and care more than ever.
Okay, that's a good place to leave it. My thanks to Mark Ishog and Reverend Jacqueline Trish Atkins for joining us. Thanks to you both.
Thanks for having me.
Thank you. Thank you.
Great to meet you.
We're back with more right after this. Chicago Restaurant Week kicks off this Friday, but don't be fooled by the annual event's name. It's actually a 17-day celebration of the city's diverse and delicious culinary scene. Diners can enjoy menus with multiple courses for brunch, lunch, and dinner at more than 400 restaurants across the city. We stopped by one of the participating restaurants, 14 Parish in Hyde Park, for a taste.
Welcome to 14 Parish, where we bring paradise to everyday life. How can I help you?
14 Parish Restaurant and Rum Bar specialize in array of rums. We have over 125 rums on our bar. All of our specialty cocktails are rum-based, and we serve Caribbean cuisine. Most popular dish would be our Rasta pasta. Restaurant Week is when we actually try a few different entrees that we don't normally feature on our regular menu to really get the customer feedback, and that's how the Rasta pasta made it on our menu. We actually featured it the first week we did Chicago Restaurant Week, and it was such a big hit we had to bring on put on our regular menu every day. We're doing a prefix dinner this year. A lot of people are really raving about the island pork chop. So it's a 12-ounce seared pork chop with a sweet mango chutney on top of our signature coconut mashed potatoes. Like I said, so all of our drinks are rum-based. It's a spirit that unfortunately a lot of people don't know how vast the spirit is.
Today we have the Mai Tai. The feature alcohol is actually Cibotan Jade, which is a white rum. It also has orgeat, which is an almond syrup, orange liqueur, as well as a little bit of lime. For my specialty, which is alcohol, I would say we are very diverse. Regardless of what you may like as far as your cocktails, coming to 14 Parish, I can assure you there will be something for you.
Restaurant Week is a mixture of Chicago natives that just really want to try different restaurants, and a lot of tourists also that are first time coming to Chicago and just trying to figure out what Chicago food's all about. 14 Parish, number one is just a vibe. Honestly, you come in here on a weekend, it's just a vibe. The music, the people, the atmosphere, it's just a fun place to be. And then when you add good food and drinks on top of it, it makes it even better.
Sounds delicious. Chicago Restaurant Week kicks off this Friday and runs until February 4th. You can visit our website for more information. And that's our show tonight. Join us tomorrow night at 5:30 and 10 for Chicago Tonight Latino Voices. 42 years in prison for a crime he did not commit. We sit down with a newly freed man who served the state's longest wrongful conviction sentence in history. And what first-generation homebuyers should know before becoming a property owner. Now, for all of us here at Chicago Tonight Black Voices, I'm Brandis Friedman. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a personal injury law firm committed to giving back to the community through law and philanthropy.